page NA Grace Choi. This is for validating maintenance of PEG tubing. I start with my 7 steps. I check the patient order, wash my hands, gather the equipment, identify the patient, introduce myself, explain the procedure, and provide privacy. First of all, I make sure I stop the feeding and the suction 30 minutes prior. Then I come to the patient, prepare my equipment. I use, this time I have my new bottle of sterile water, and I'm going to indicate the date, my initial and time, and put it on the sterile water bottle. If it's not new, you just make sure it's not older than 24 hours. All the equipment's right here. I'm going to now prepare 30 cc's of saline water. Now I look at the x-ray just to make sure that tubing is at the right place. And I want to assess the area. Before I assess, I just make sure the bed is my height working level, and the head of bed is between 30 to 45 degree angle. Okay. While I am providing privacy, I'm going to check the site of PEG tube. There's no swelling, no discharge, no redness, no irritation, so the site looks good. I'm going to make sure I wash my hands and use the clean gloves. Okay. I'm gonna clamp the tubing and then listen for the bar movement sound on 4 quadrants. So I did hear the bar movement sound, which means tubing is at the right place. Now I'm going to clean the tubing site, aspirate, unclamp it and aspirate.
So I left the towel on.
You check the amount, make sure it's less than 100. If it's more than 100, you stop and contact the healthcare provider. And you check the consistency, color, any odor, any abnormal findings, and you push it back. Clamp it again. I'm going to draw off 30 cc's of saline water now. Okay. Unclamp it. I'm going to connect the PEG tubing back to the feeding tubing, and also with the suction back on, and also just make sure that the rate of feeding is back to the original flow rate feeding. The safety, you put the rail up, lower the bag, client is at the comfortable neck position, and I make sure I document any abnormal findings. I document on I and O sheet.
You turn on the suction.
I made sure that I turn on the machine, the suction and the feeding, discard my gloves, and then complete complete the PEG maintenance validation. Thank you.